Welcome, everyone, to the Karen Rizzo Show, Navigating Our Healthcare System. Thank you for tuning in. We are going to be discussing today the importance of choosing a primary care physician, and we want to do many thanks. We talked about it a little bit last week when we had our guest, Diane Daniels from the Medicare Nation on. She really stressed the importance of what a primary care physician can do for your overall health and wellness. She, of course, was looking at it from the Medicare insurance side of things, which we're going to get into a little bit as well. When I was writing my book and I was working in the healthcare industry, the reason we had to start with the primary care physician is because he or she is the co-pilot of your health journey. They are the gatekeepers in many cases. They can control testing, schedules, home care services, rehab services, hospitals. And we're going to get into some tools today that you can use as a resource when you're selecting a primary care physician. Now, just to start, many people, if they're in a Medicare Advantage plan, are assigned a physician. And you do have the option, if you get assigned a physician that you do not care for, to be able to call the member services line on the back, which is an 800 number on the back of your card, and ask for a different physician. But what we're going to be talking about today is actually researching a primary care physician. We're going to get into what is a primary care physician, which doctors qualify as a primary care physician, how can you find one, and why should you choose one yourself. Basically, this person can be your advocate, or they can be your biggest nightmare. So we really want to make sure that when you're selecting a primary care physician, you're choosing someone that you know their background, their training, their affiliations, and has your future health goals in mind. Everyone has a different health situation. Everybody has different situations and diagnosis and gene pools that we all work with. But a primary care physician, and we're going to get into the different types that you can select, and then also some tools online that can help you understand their training, their background, what they prefer in terms of medications, vitamins, supplements, alternative medicine, all of those different things. So one of the things that qualifies someone to be a primary care physician, they're generally either internal medicine or a family practice. Now, a family practice doctor is someone who can treat the whole family. That's somebody that has been trained to treat children as well as seniors, everyone in between. An internal medicine physician, interestingly enough, their training focuses them on diagnosis and treating diseases. So this person has had extra training, and they have gone through extra time in med school to learn the chemical breakdown of diseases and how to treat them. There's pros and cons to general practitioners versus internal medicine physicians, but that's something that everyone would have to choose on their own based on their own health care. Now, internists, which are doctors who practice internal medicine, they also are board eligible, and we're going to get into what that board certification entails, what it involves for the doctor, and it's helpful for someone who's a caregiver or even choosing for themselves a physician to know basically why that board certification is so important. It's just an extra educational tool. Now, getting into finding a primary care doctor, and especially for those that travel, we get a lot of snowbirds in this area here in Florida. We've got some that live 6 months here and maybe live 6 months up north or in Canada or in a different area. So especially if you have a temporary primary care doctor, it's really important that you still know who's taking care of you in an emergency. Now, there's a lot of different ways you can find a primary care doctor. People, word of mouth, at church, neighbors. Your health insurance plan is only going to be giving you doctors that have a contract with them. So it's okay if you really like your health insurance plan, but if you are on traditional Medicare with a supplement, you have the freedom to go to basically any physician that accepts Medicare, and at least in our area, almost all of them do accept Medicare. So why should you choose them? Well, it's all about being empowered. It's all about you knowing that your primary care physician can be your advocate, is going to be there for you in a case of an emergency. And furthermore, we're going to get into a little bit of the good stories with medical management and some of the horror stories with medical management. There's been both throughout the years, and a lot of this has to do with planning ahead. So the kind of the running theme of the show is not just being, a victimized, or not just assuming that we're never going to get sick, because the stats don't support that. Basically, when you're getting into the aging statistics, I wanted to touch on this a little bit. 70% of people 65 years and older are going to need some type of long-term care. Now, 70% is the stat. Now, if we could get a 70% return on a CD or an IRA, would we take it? Yes. So if we know that we're running into this demographic where we're going to need long-term care services, it's very important that the doctor that is your primary care physician, who's going to be controlling those services, is one that has your back, that is exceptionally trained, has hospital privileges preferably, or works with a really good hospitalist group, and is somebody who supports any alternative medicine or habits that you have. Some people are very traditional. They want a mainstream doctor that's a medical doctor with an MD. And then there's also some people that prefer a doctor of osteopathic medicine, which is the abbreviation for DO. The differences between a DO and an MD are pretty good. The doctors of osteopathic medicine tend to have a more holistic approach to managing their patients. They look at the whole body as a whole. They also support a lot more supplements, vitamins, therapies that are preventative. Medical doctors are very much, I always prefer to think of them as they're the problem solvers. They're the fixers. They're the ones who really get into the nuts and bolts of a disease and try to manage it medically and through the standard practices of medicine. Now, both of them can be board certified, and I always recommend that you find out if your primary care doctor is board certified, because that is an extra 2-year training that they have to go through. They have to pass a test. It's very rigorous, but it also keeps them up to date with all the current medications, all the current practices of medicine, and it can make or break a big deal with them. For instance, I'll give you a story here of good medical management. We had a lady that went to a hospital. Bronchitis, it happens, we get the flu or bronchitis. These temporary conditions can occur. And the physician at the hospital prescribed her some medications to manage that. Now, the doctor that she was seeing in the community didn't have hospital privileges. So even though the family tried to give the doctor at the hospital an accurate medication listing, he inadvertently ended up prescribing 3 medications that were contraindicated or should never have been given to her. So when she got home, the family thought she was practically dying because she couldn't participate with the physical therapist. She couldn't get out of bed. They were having to do around-the-clock care for this woman. And luckily, the director of nursing for the home care agency and myself were able to get a board-certified hospitalist physician to come in to the home, and there are still doctors that make home visits, by the way. They're rare, but they're there. And he was able to get her on the correct medication management for her bronchitis, and within 2 to 3 days, she was participating with therapy, she was getting stronger, and within a month, she was driving and back to her usual habits. So one of the tips that I always try to highlight, and that's a good medical management story, but it also demonstrates and enforces the importance of good medical management. When you have a doctor that is trained, is aware of which medications a patient shouldn't be on, they're not going to give it to them. They're not going to prescribe it for you or for a loved one. So one of the things I always have recommended to families is please do your research. We trust, many other professionals in our lives, realtors, financial investors, and we shop around. We do a lot of work on that, and we do a lot of research. But we should also be doing research on our primary care physician. In the book, I also highlight a physician interview form. You want to do your research. There is a tool that's excellent. It's really, really one of my favorites. It's called healthgrades.com. Again, that's healthgrades.com. You can put in your zip code. You can put in any doctor's name. You can find out where they were trained, Are they board certified? What hospitals they're affiliated with? Where do they practice out of? And patients can give satisfaction and reviews. So it's kind of like a TripAdvisor for primary care doctors. Also, if that primary care doctor is in a health system with other specialists like cardiologists, neurologists, then you can also look and see what systems and what affiliations they have with them. What's great about this is you can also put a review on. So if you go to your doctor's office, you have a horrible experience, you can also log that. I mean, if you have a good experience, the staff were helpful, you got right in, you can also log that as well. One of the doctors that has been around in this area for a long time is a great guy, Dr. Fitzgerald here in the Largo area. He's affiliated with the HCA system. So you can go right on there. You can see all his patient surveys. He's a good guy. It doesn't surprise me. He's got a 4 out of 5 star rating. And he also has a delightful spa right next door that his wife manages. Another physician that is local in this area, Dr. David Bernstein, again, board certified. He works out of the Bay Care system. And you can go in and see all of his training. Again, he's got a 4.5 star. Look at that. But you can see if they're also accepting new patients, because some doctors, especially if they have hospital privileges and or they go to nursing homes or assisted living facilities, they might not be willing to take on more patients if they don't have like a physician assistant or a nurse practitioner to help them. So you really want to do some research on your physician. Again, some of the doctors are shifting their models and strictly working outpatient, and then they're collaborating with hospitalists that they have an affiliation with. A lot of that has changed because most of the offices and the hospitals are now going to electronic medical records so that they can easily communicate. So it's really good to find out if you have a doctor that, first of all, does already either has hospital privileges, preferably one you like, and again, also has the ability to speak with somebody in the hospital if, a loved one would end up there or not. Now, and people have laughed at me sometimes of saying, why would you interview your doctor? That's the craziest thing. You get, your doctor's your doctor. Well, they don't trade for chickens anymore, for one thing. They get paid based on the insurance contracts that they have, and different doctors have different business models. And that's one of the reasons why it's very, very important that you know what the business model is for your physician, especially if you have somebody that is 65 or older or is getting in there. Case in point, there's a doctor locally, really great guy, who takes care of the Tampa Bay Rays. He's their staff physician. Well, he really even though he is an internal medicine doctor, he does not want patients over 65. So if you're over 65, that's not necessarily going to be the doctor that you really would want to choose. You want to make sure that your age, your health needs, everything matches the primary care physician. Why is that so important? Because of what I call unplanned events. Nobody ever wants to wake up in a hospital bed. Everybody wants to wake up every morning healthy in their own home. That's just our human natures. But for those that have ended up waking up in a hospital bed, either it's an accident, a fall, a fracture, a stroke. These are the most common afflictions that can happen to elderly people. That primary care physician, he or she is running the show. He's going to be calling in all the specialists. He's going to be making sure that there's home care services when you go home. And he's going to be also, if there is rehab needed in a rehab center, he's going to be the one making all of those referrals. Now, again, that's one of the reasons why the business plan enters into it. Now, if your primary care doctor is the medical director of a hospital or a rehab center, that's who he's going to refer to. Now, people don't realize that physicians have medical director positions, and those positions pay them quite well every month. And basically, these are rehab centers that go into partnerships with certain physicians, and they either have partners that round for their patients in these centers, or they round at the hospital for these patients in these centers. So either way, it's good to know who the affiliations are, because if you're working with a physician that maybe has a partnership with a rehab center that you don't prefer, then that's going to be rough if you're trying to get your loved one to a different nursing home. We are going to have a whole show dedicated to selecting nursing homes. We have another show coming up that's going to be selecting assisted living facilities. And then next week's show, we're going to have my dear friend Sue Ross on with Always There Home Care, and she's going to be getting into the nuts and bolts of selecting home care services. Now, that's where all this specialty training, board certifications, and the interview form becomes important. Because if you have a doctor, say, for instance, you like a certain hospital situation. And by the way, you can also, if you're active on Facebook, you can go onto these hospitals' Facebook pages and like them, and they'll invite you for free to come in and meet their on-staff physicians. They offer free lunches and coffees and meet the doctor programs all the time. And it's a great way to know, do you trust this healthcare system and this hospital system versus another one? Now, if you're a veteran, that's a different story. If you're in the VA healthcare hospital system, they assign a doctor to you. You have very little choice in that. Sadly, if you have a problem with the doctor and you can't understand the doctor and you're in the VA system, you can go to a social worker or a veteran service officer and ask for a change. It's not as easy to do if you're on traditional insurance or traditional Medicare. But at the very least, you should be able to understand what your doctor's instructions are for you. If there's a language barrier, that's another situation to deal with that you really want to make sure that you address. If English isn't your first language, then you want to be able to go on, and you can go into healthgrades.com and find a physician that speaks Russian or speaks Spanish or speaks some other language that your loved one can communicate with. The last thing you want to do is have a primary care physician that can't understand your signs and symptoms, or you can't understand the instructions they're giving you. So all of that comes into, I call it the match made in heaven. You really want all of your healthcare providers to match your age, your services, your health needs, and plan and prepare for a rainy day. So that's one of the reasons why the physician interview form is so important. You can find out a lot of the information on your primary care doctor's partnerships just by who you see in the waiting room. You can always call the office and ask the girls, does Dr. So-and-so have hospital privileges? Does Dr. So-and-so work with any rehab centers? Which Medicare home care agencies do they refer to, and why? And quality physicians are trying very hard to protect themselves, so they're going to align themselves with quality providers of care. Why is that? Because they don't want a lawsuit. We're in a very litigious society, and their malpractice insurance goes up every time they have to defend themselves in a malpractice lawsuit. My background started where I was actually an administrator for physician offices for 10 years before going into the senior living markets. So I can tell you from both sides of it, the stresses that physicians have in making sure to care for their patient load, but also keep up to date with all the new standard practices of medicine, and also be able to give good patient care. So when we get back, we're gonna take a quick break, and when we get back, I'm going to get into a little more about some other tools and resources that you can refer to.
Are you looking for some great restaurants? For some great wines? Where are the great chefs? Listen to Dine Out Radio, heard every Wednesday on the Tan Talk Radio Network. 12 to 1 p.m., we'll tell you where all the great events are. We'll have Food and Wine Magazine and Bon Appetit Magazine. We'll have their editors and writers on each month. And maybe we'll throw in a couple surprises. Check out the website, diningoutradio.com.
My bridges all...
Lightning fans, there's no better time to reserve your 2015-16 season tickets than now. Season ticket members get the best seats, the best discounts, playoff priority, exclusive player access, and more. Reserve your 2015-16 season tickets by calling 813-301-6600 or visit TampaBayLightning.com. The Tampa Bay Lightning. Be the Thunder.
If you're in the market for your next car, then the place to shop is autoshopper.com. You'll have access to hundreds of dealers right here in the area, and you can search over millions of cars nationwide on autoshopper.com. Autoshopper.com is in hundreds of locations in the Tampa Bay area. Find your next car by taking advantage of all the power and reputation of autoshopper.com. From your desktop, you can read car reviews, automotive news, calculate payments, use our tools to research, and get a Carfax vehicle history report at autoshopper.com. This is the publication to pick up and read when you're looking to purchase your next car. Log on to autoshopper.com and search for your special vehicle. And if you want to sell your vehicle, then advertise it in autoshopper.com magazine. The readers can view a picture of your car and call you directly. It's all happening at autoshopper.com, your auto buying and selling source. Pick up the magazine today or log on to autoshopper.com, the premier source for car buying or selling. autoshopper.com.
Hi, this is Misty Wells, your host of Let's Take It Outside. Join me every Friday, 5 p.m. on your ride home. We'll talk about getting outside, getting dirty, fishing, hunting, diving, and camping. Whatever you like to do when you take it outside. Spend your afternoons with me, Misty Wells, Friday, 5 o'clock, right here on the Tan Talk Radio Network.
This is the Tan Talk Radio Network.
For tuning in to the Karen Rizzo Show on navigating our healthcare system, based on the best-selling book, Aging in America, Navigating Our Healthcare System, which is available on Amazon, Nook, Kindle, and at agingguidebook1 with the number 1.com. For those of you that want to follow along the next couple of weeks' show, what we're going to be doing is highlighting the key components to aging in America. Today, what we're discussing is why a primary care physician is so important, why it's important for you to choose one, do some research on it. Having worked in the healthcare community with many physicians, and you can understand some differences. The key differences when you're doing some research on your primary care physician is that you really need to, especially if you're over 65, you're dealing with someone over 65, or you have a loved one that's over 65, you really want to make sure that that primary care physician is your partner. They are actually going to be the wellness partner, the coach. I know many physicians that become very, very involved with their patients. Some of them do home visits. I know of a physician that down in St. Petersburg, he throws a big holiday party every year in the parking lot, and that's not one to miss if you get an invite for Dr. Guerrier's parties every year. He takes no sponsorship lunches at all from any vendors, but once a year he throws a big party for all of his patients, and they celebrate the holidays together. So there's very, very heartwarming physicians out there, but they all have different training levels. They all have different business models. And it's a good thing when you've selected a primary care doctor. A lot of people aren't aware that Medicare now offers an annual visit, and most of your primary care insurances, even if you have the Affordable Care Act, Humana, United, any of the big fours, you can do an annual physical that's called a wellness visit. Now, this wellness visit is meant to look at your habits, look at take some labs, testing, make sure that if you are having any symptoms that they can curb it before it becomes an emergency that lands you in the hospital. So how do you prepare for a visit? Well, many physicians give you 3 to 5 minutes, maybe a whole 10 minutes if you're lucky when you get in front of them. They have on average 40 to 50 patients a day they might be seeing. So it's good to be prepared. If you have questions, make sure to write everything down. I always tell people bring an accurate medication listing, which includes vitamin supplements. If you're doing anything else, juices, drinks, diet mixes, anything like that, make sure they know that, because those components can interact with any medications they might be prescribing for you. And then also make sure that you have any specific questions in mind that you can give them. Again, I can't stress the importance of choosing your own primary care physician yourself, because it's almost like choosing a girlfriend, partner, husband, realtor. Any big decision you make in your life that involves your health and your wellness, and your money for that matter, needs to be somebody that you've known, that you've trust, that you understand their partnerships, their alliances, and you prefer those alliances. if you're if your primary care doctor has privileges in the HCA system, for instance, you're going to an HCA hospital if you need to. If they're part of the Baycare system, you're going to a Baycare hospital if they need to, or rehab center. So it's extremely important that when you're making this decision, you're empowered to choose the one that you prefer. Again, making sure that if there's any language barriers, those are addressed. There's a physician, for instance, these partnerships are important. There's a physician, a primary care physician. I'm going to give you the horror story now. I've already given you the good medical management story, but there was a physician that used to practice in our area that had a husband who was also a physician. He was a gastroenterologist. So for those of you who remember the Terry Schiavo situation, gastroenterologists are the surgeons that install PEG tubes in patients that can't swallow and need nutrition. So every single one of this primary care doctor's nursing home patients got a referral to her husband for possible insertion of a PEG tube. Now, we had to sometimes bring the ethical officer for the hospital involvement because many times these patients didn't need a PEG tube. And the last thing you want to do to take away from a nursing home patient is their chocolate and their food and their sweets. I mean, when they're reduced to a wheelchair or already have other situations that have made them go long term in a nursing home and not being able to be in a position to live in either assisted living or in a home setting, their food is their everything. So the last thing you want to do is take away that ability to swallow and eat if that's something that was happening. Yet every single one of her nursing home patients got a consult for her husband to have a PEG tube. Now, those of us in the community would, when it was not justified, would fight that. But again, that's another situation that you should know about your primary care doctor. And again, you can find these things out on ratemds.com, on healthgrades.com. The internet's been great about being able to really help us understand who our providers are. And that applies to all of our healthcare providers, not just our physicians, all of them. You can go in and see a star rating. And the good news is starting next year in 2016, there's now going to be star ratings for home care agencies. Now, there's already star ratings for doctors. There's star ratings for assisted living communities and nursing homes, and hospitals. But now the Medicare home care agencies are going to be receiving a star rating. So that's going to be based on the annual surveys they go through and their outcomes, which is huge. So any entity that's taking Medicare money or insurance money on any sort goes through an annual survey situation, except your physicians. So the physicians, now they're going to be getting hit for, anytime that certain patients of theirs have to get readmitted into the hospital with 30 days, that's going to be hitting their pocketbook over the next couple of years. So they're being much more diligent about ordering home care services and any kind of intervention methods to keep people from having to go back to the hospital. Again, you'll be able to see all of those different changes in the way we're practicing and managing medicine from a hospital standpoint when you do the research online. Now, there's a couple of other websites that I'd like to refer you to. One is called Vitals, VITALS.com. Another one's called informedpatient.org. It's a national organization. And then you can always go into the HCA.com, Baycare.org. Florida Hospital is another one that's in our area, the VA.gov. You can go on there, and when you're looking for a physician, you can see their training, their background, their affiliations. If there's any pending malpractice suits, you can see that as well. And then there's a great website I've used for years called wellness.com. And that's another one that I have referred patients to. Now, at any point, you can always get a second opinion. If a doctor's put you on a medication, it's not working. If you've been in multiple times to see the nurse or to see the doctor and let them know it's not working, you're still having the symptoms. And especially if you have a chronic health condition like you're a diabetic, or you've had any heart conditions, any lung conditions, if you're oxygen dependent, some of these medications are very, very important. And you really want to make sure that if you have multiple doctors, that you have an accurate medication listing that you're bringing your primary care doctor, because he or she's the one who's going to sort all that out for you and really make sure that every condition that your body's going through is being managed accurately. And that's where the importance of this accurate medical management comes into play. Now, one of the things that many people don't realize is that if you have a chronic condition like a lung condition, for instance, and you're on oxygen, a lot of pulmonologists actually function as a primary care doctor. Many of them have multiple trainings and multiple specialty training in internal medicine and pulmonology. So many times, because we have to breathe, it's the most crucial thing to being alive. Those pulmonologists are the ones that usually function as a primary care doctor. So if you're in the hands of a good pulmonologist, and they might be managing more than just your oxygen, sleep studies, those kinds of conditions, there's no need to go run out and grab another primary care doctor. Sometimes if there's too many cooks in the kitchen, it's not really helpful to your overall wellness. So it's very important when you're looking at who is taking care of you, that you make sure that you have the people that are supporting all of your habits, that if you are getting alternative medical treatments like from a chiropractor or other supplements, vitamins, things like that, that they support that, and that's something that is crucial for you. Now, many people that are on Medicare Advantage plans, we're going to talk about this just a little bit because this is how the Medicare Advantage plans are. Diane Daniels got into it last week when she was discussing the pros and cons for being on a Medicare Advantage plan versus not being on a Medicare Advantage plan. Now, the federal government pays the insurance companies to administer these plans. The insurance companies go into contracts with doctors for X amount of patients. So how do the doctors get paid from these plans? The doctors get sometimes a per head what's called a capitated fee from the insurance company for however many patients they have on that plan. So whether you see the doctor that month or not, they're getting X amount of dollars from the insurance company for however many patients they have on that insurance plan. So you should be aware of that. Plus, they also get paid for any visit charges as well. Now, some of the physicians have gotten into what's called full service contracts with the insurance companies. I have some physicians right now that are probably really mad at me, but this is the truth of it. Now, the full service contracts that they enter in, those doctors get penalized when they have to make referrals to specialists, to expensive procedures, and most of those full service contracts, there's an insurance company case manager sitting right in their office calling the shots for medications, for treatments, for labs, for x-rays, for any kind of specialty consultations, any rehab center authorizations, all of it. So if you walk into an office and all you see is an insurance company's banner everywhere, you might be walking into a physician that's under a full service contract with the insurance company. And if you're on that insurance company, it's very much going to tie the doctor's hands on what they can order. Every insurance company gives the doctors a formulary for medications. And if you think that a doctor in a practice is not saying, hey, nurse, is this a Medicare traditional or is this a Humana or traditional or an Advantage plan? You're deluding yourselves. They don't trade for chickens anymore. They're still running a business. That is the business of our reality here as we age in America. So if you walk into an office, and I've seen this multiple times, where all you see is, you should be on this plan, you should be on this Advantage plan, you should be on this Advantage plan. Okay, they used to be called HMOs, by the way, before HMOs got a bad rap. But anyway, if you walk in there, you might be dealing with a doctor that isn't going to have the freedom to prescribe everything that he or she would otherwise want to prescribe for you. So it's good to be aware of what you're dealing with when you're dealing with a Medicare Advantage plan. Now, if you get into a situation that you're part of a Medicare Advantage plan and you don't like your doctor, you can't understand your doctor, that's when you empower yourself. Get on the phone and do your research for another doctor that has a contract with that Advantage plan and change. You're not locked in here. anymore. And the patients that, and I know some people were raised in an era where we don't question authority figures. We don't question our doctors, or whatever the doctor says goes. But I'm here to tell you, you need to question your doctor. If you got one that's not working out well for you, question them. Get another one. Get a second opinion. Go and do some research. Go online. A lot of the senior centers even have computers and classes that will teach you how to use the internet if you do not know how to. Now, especially, I really, really want to stress this part. If you're dealing with a low income senior that's on both a Medicare plan and community Medicaid, do not be on a Medicare Advantage plan, because if you're under $1,100 was the cap or less for Social Security income, you're already eligible for traditional Medicare and Medicaid will then cover that $104 monthly premium that you would otherwise have to pay. So if you're under Medicaid as a supplement and you are a low income senior, or you know of somebody who's a low income senior, the insurance companies do wine and dine a lot of our seniors. Okay, but understand that traditional Medicare with Medicaid or traditional Medicare with a supplement is still going to give you access to the best providers, the most amount of freedom, and the top notch of everything: medicine, treatments, testing, labs, x-rays, anything that might come up. You're going to have the most ability to get to the best care. So that's one of the things I always try to stress when I'm working with groups of seniors and everybody on this topic. Again, this isn't about bashing physicians. This is about choosing and matching your health and wellness needs with the doctor that's going to be your advocate, your coach, your best friend in some cases, but is going to really have your back. So when we come back from the break, I'm going to go through some community events that are coming up. And then we're also going to get into some other ideas and new programs that are coming up for 2016. It's based on the best-selling book, Aging in America, Navigating Our Healthcare System. If you care to get one, you can get it by Amazon, Nook, Kindle, or at agingguidebook1.com. For those that don't have access to the internet, you can always mail a $19 check to Elite Marketing at P.O. Box 7221, Seminole, Florida 33775. Today's show, we're talking about choosing your primary care physician, which comes into the running theme of owning the process of navigating our healthcare system as we age. My experience has been that those that planned ahead, did their research, planned for a rainy day, had a much easier time than those who thought that they're never going to get sick, never end up in a hospital, I'm going to be home, my kids better take care of me. It's much better to be realistic about the aging process, about the fact that, over 70% of people 65 and older are going to need some type of long-term care services. And guys, the average lifespan has grown in our country. It's now up to 99.3 years old. So the days of everybody thinking mom and dad might be done at 70, 75, 80, it's not happening. We have more people living well into their 90s, well into their hundreds than we've ever had in our nation's history. And for the first time also in our nation's history, we have more grandparents than we have teenagers. We have more people over 65 than even teenagers. First time in our nation's history here in America. So one of the things that we're going to be covering each week are all the key components to aging and taking care of a senior or an elderly person, or if somebody is on their own, what resources are out there for them. Today we've been getting into the nuts and bolts on choosing the best primary care physician. Next week I'm going to have the title is Caring for Your Caregiver, How to Find Respite Resources and How to Choose the Best Home Care Agency. We're going to have a guest, Sue Ross from Always There Home Care. She's our home care expert. We're going to get into the differences between Medicare home care and private pay home care. We have also landed a couple of guests, a geriatric care manager and an elder law attorney that's going to be on the show here in a few weeks. I have somebody coming in just speaking just on nursing homes, how to pick a nursing home. Nobody ever wants to be in a nursing home. Granted, it's a gloom and doom situation, but yet most of the nursing homes are filled with people that are recovering from some kind of illness on a very short-term basis. So half of our nursing homes right now in our area don't have long-term care residents living in them. They have people recovering from something short-term. So it's always good to plan on that as well. We're going to be getting into veterans benefits for retired military and spouses. That'll be happening in one of the January shows. I have a guest coming on board for electronic and personal health records. And then we are going to be very pleased to have an officer from the Largo City Police Department's Senior Services Division that's going to be coming in to know, as a community, if we see an elderly person being exploited or neglected or being a victim of scams, she's going to be joining us to get into all of those over the next 2 months. So stay tuned as we go along, and we're going to be able to have call-ins on some of these shows as well, where if you have a question, you can come in and ask the expert on that. We also wanted to make sure, always every week I go through some community events that people are able to participate in. AARP is doing a few initiatives right now. It's called a Time Out for Caregivers. Tuesday, December 8th from 6:30 to 8:30 at night at the Hilton St. Petersburg Bayfront Banquet Room. They're having a little meet and greet for caregivers. So you can come in, you can talk with some experts. It's free, no cost, and that's at 333 First Street South, St. Petersburg. That's right there on the bay, the Hilton St. Petersburg Bayfront. Wednesday, December 9th, they're going to be having another meet and greet at the Hilton Garden Inn, North Tampa. That's again at 6:30 to 8:30. It's for caregivers, and that's going to be in the Preserve 1 room. And then lastly, Wednesday, December 16th, again, 6:30 to 8:30, they're doing a caregivers happy hour, which should be fun, at the Doubletree by the Hilton Tampa Airport in West Shore. So those are a couple of events that are coming up. That is courtesy of Michelle Sear from AARP. There's also going to be a Memories Art Workshop. So if you're looking for an activity to do with somebody who's either struggling with dementia or would like some art, on Tuesday, December 8th from 1 to 2:30 at the Old Hyde Park Art Center, they're going to be having an art workshop. So that's another event that's, again, all these events are free, doesn't cost anything. Another event that we're going to have coming up, and I'm so excited about this event, it's the first ever in Pinellas County. We're having a Senior Empowerment and Education Day. It's free to the public. The lunch is being provided by the Palms of Largo, and that's going to be Saturday, January 30th from 10 a.m. to 2 p.m. at the Largo Community Center, which is located at 400 Alternate Keene Road, Largo. It's going to be free lunch, door prizes. There's on-site respite care being provided by Arcadia Home Health. And the police department is actually going to be getting involved in warning the public on what scams are going around our county right now. We recently had an 82 and an 84-year-old that had been scammed out of $50,000, basically their entire savings, and both of them started needing health care. And of course, once the money was gone, now we have to resort to Medicaid, and unfortunately, a lot of their options to stay at home were no longer available. So that's one of the things that we're going to be having coming up, which is pretty exciting. And one of the sponsors of our show is going to be here next week. That's Sue Ross with Always There Home Care. They are a locally family-owned home health agency, and they don't provide Medicare treatments. They provide other care, which is called activities of daily living. So they provide bathing, dressing, grooming, meal preparation, light housekeeping, and much more. And they are available from 1 hour a week, which is very, very rare, as to up to 24 hours a day if need be. And she's going to get into the 15-step recruitment process she has and the kind of staff that they want to hire. When somebody's going into an elderly person's home, it's very, very important, the person that's being selected, because they usually need the care and they're vulnerable. So it's very important to shop around and know what to look for when you're hiring a home health agency. If you are needing services today, go to alwaystherehcs.com, or you can give Sue Ross a call at 727-547-2500. Again, that's 727-547-2500, and tell her you heard about them on the Karen Rizzo Show. So one of the things that we're going to be outlining in our upcoming schedule is getting into everything from home care, veterans benefits, ways to protect yourself, empower your senior. And today, just to sum up a little bit about the primary care physician, use the websites that are out there and use the tools that you can know to go into and meet the doctors that are coming on board at different hospitals. Like I said, if you are part of Facebook, you can put in a hospital name, join them, and they're going to start inviting you to all the little lunches and coffees and meet and greets so that you can meet the new physicians. They also every hospital has an educational program where they have doctors that'll come in and talk about cardiac issues, medications, new treatments, all of these things. Again, your primary care doctor is going to be the one that is going to help you the most. Some of the websites that we discussed today were ratemds.com, healthgrades.com. Of course, you can always go to hca.com. There's baycare.org, va.gov if you're involved in the veteran system, and informpatient.org, which is a nationwide organization that really promotes a whole lot of education for patients. If you're looking to get a copy of Aging in America, Navigating Our Healthcare System, you can do so at Amazon, Nook, Kindle, and at agingguidebook1.com. If you don't have access to a computer, again, you can mail a $19 check to Elite Marketing at P.O. Box 7221, Seminole, Florida 33775. If you're in a situation where you're needing a personal question answered, you can always email me directly at agingguidebook@gmail.com, or you can simply call 727-452-1300, and we'll be able to find out what your specific needs are. Basically, we just don't want to be in a situation where somebody is at risk or in an emergency or is having some difficult illnesses without being able to have some support services. So for those that are following along with Periscope, it's at Karen Rizzo Show 1 on the TanTalkNetwork.com. There's also a Facebook page called The Karen Rizzo Show. Every week I will be introducing and letting you know what the next show is going to be so that you can tune in. It's also available on YouTube. So if you Google Karen, Karyn, Rizzo, Rizzo, you can catch and tune into any of the shows that you've missed. There's also a podcast that's coming up through the Tan Talk Network. So we have lots of different ways. If you miss anything or there's a title, you can't get to it, you can't be available Tuesdays at 10 a.m. every week, feel free to plug back into the other shows and catch them every week with us. So as we're aging, and remember, we're all aging, this show is geared to help you age healthy, wealthy, and wisely. And please keep in mind that it's available free online through the Tan Talk Network, and we're always here to answer some questions. Again, you can always email me directly at agingguidebook@gmail.com, or go onto the website, which is agingguidebook1.com, and we'll be happy to answer any specific questions that you might be needing. Save the dates though, guys. There's a lot of good events coming up. Plan on being at the Senior Empowerment and Education Day. By the way, if you're interested in that, reservations are required. You do need to call the community center and make sure that you reserve your lunch. It's free, no charge, but we are asking for people to register their place in advance. That is, again, going to be the Senior Empowerment and Education Day, Largo, at the Largo Community Center, which is different than the Cultural Center. The Community Center on 400 Alternate Keene Road. Thank you for tuning in. Appreciate it. And please remember to stay healthy, wealthy, and wise.